Lesson number 3, the big picture. Putting patient responsibilities into practice. Hi, it's Mike. How are you doing today? Thank you for coming. It's good to see you again. We're going to put the things you learned in Lesson 2 into practice today. That's why I'm calling this the big picture. I'm going to give you an example to look at today that will involve the terms that you learned about from Lesson 2. I'm going to keep this example very simple for right now. This simple example will help you to solidify the concept from Lesson 2. We will approach some more advanced topics later. Here's our example. Frank has gotten a new health plan through his employer. He has a deductible of $3,000, a copayment of $30, and an out-of-pocket max of $5,000. It is assumed that Frank is staying in network for all activity in this example. Remember our lesson from last time. Whenever there is a deductible, that balance must first be exhausted. So Frank will have to shell out $3,000 first for any claims that are processed through his health insurance plan. Then the policy will start paying off. Once the deductible has been met, there will be a copayment of $30 of the approved amount for all remaining claims processed. That'd be a patient responsibility of $30 each and every single time until Frank reaches his out-of-pocket max of $5,000. You might ask, how will Frank know when he's reached his deductible, and how will Frank know when he has reached his out-of-pocket max? Easy. After each claim has been processed, Frank will receive a document called an explanation of benefits statement from his insurer. All of Frank's financial totals, including what he will owe to his healthcare providers, will be on that statement. His deductible balance, his copayment balances, what the insurance paid, and what the insurance did not pay, all of his financial totals and liabilities will be on that statement. Unfortunately, mistakes are made on explanations of benefit statements, and sometimes the calculations are in error. So sometimes patients can often pay for things that they should not have. That is why it is always important to keep your explanation of benefit statements so you'll always know what your financial balances are. And also review them when you see them. If you only went to see the doctor for an office visit, then that's what should be on the explanation of benefits for that date of service. Also, if you have your explanation of benefits available, it will be far easier to appeal any decisions that are made by the insurance company. An appeal, if you want to appeal a claim, for example, is just a request for a review of an insurance claim, nothing more than that. There are more difficult matters, but they're rarely seen. But usually an appeal is just, it would be for a specific coding. It could be for a coding sequence. It could be for a diagnostic sequence that was not either put in or not put in, or something to that effect. But usually an appeal is just a request for a review of an insurance claim, simply put. Most people, unfortunately, don't keep their explanation of benefit statements, and once again, these are usually the people who get burned for huge amounts of money through the process of balanced billing. Because since they've lost their explanation of benefits, their financial balances are unknown to them, and they don't know what they owe their providers, and they don't know what the insurers paid. Many of these people just assume and expect that others will automatically know their financial balances for them. And that's not a very good way to go. It is always important, if you don't receive an explanation of benefits from your insurer, make sure that you contact them immediately, if not sooner. I've seen some incredible things happen with explanation of benefit statements over the years. On that note, that concludes our lesson for today. If you've enjoyed what you've heard today, please subscribe, like, and comment. Thank you for your time, and take care.